Nurses Week. The workbook is finished. I am really, really proud to introduce you to our Nurses Week 2020. 2020 is coming, it's coming. 2024 workbook right here for you guys. So I did want to just let you know that this is a very unique book. This event starts next week, and it's not too late for you to sign up for it. If you need to sign up for it, just hit up remarnurse.com/Nurses Week. But what I love about this workbook is that it has inside of it questions for every day. So you see there Monday, then Monday we're going to do priority nursing questions. And then on Tuesday, this is our test anxiety workshop Tuesday. And then Wednesday, we have Winning Wednesday. And I never have a workbook for Winning Wednesday or Monday motivation, but Winning Wednesday, these are the questions we'll be going over. Thursday, we have critical thinking workshop. Sunday is our International Nurses Day. Oh, so you gotta get this workbook. Again, next week is gonna be so good, so good. We have something every day. Check out the times really quickly. Nurses Week, Remar Review is presenting that for nursing students. So if you're preparing for NCLEX, this is the biggest party in town next week. Monday motivation is going to be at noon Eastern time. Tuesday is our test anxiety workshop, life changing. You don't want to miss this workshop. I'm not just saying that because I'm teaching it, but chains will be broken. Chains will be broken. So I'll say that much. Winning Wednesday will take place the same time we do it every week, 9 p.m. Eastern Standard Time. Our critical thinking workshop will be that Thursday, May 9th at 8 p.m. And then Sunday, we have International Nurses Day. And so this is an NCLEX review. Although we are recognizing International Nurses Day on Sunday, that NCLEX review is for everybody. So if you sign up, you will get the workbook, you'll get all of the announcements and or if anything changes. But yes, next week, biggest party is Nurses Week here at remarreview.com. On tonight, though, we have the pleasure of talking about the Apgar score. Apgar score is something that you must memorize. You must be fluent in being able to evaluate a newborn because it is really a great way to save a life. And that's what it's all about. Now, typically we are studying from what book? Typically we're studying from Quick Facts, which I do believe every nursing student should have. It's my favorite book for just really quick content. However, I told you we were making a transition. And so we're going to be starting to study things from the student workbook that is the other half of the course. So most of my information now will be coming from this, the V2 student workbook. And this book is the one that goes along with the lectures so that you are able to get more in-depth information. So if you don't have this V2 student workbook, what you will find is that you still need to review all of these topics that are in here. Okay. And so Apgar score is one of them, but it is part of the maternity overview that I do specifically in those lectures. So I'm going to try to highlight this information for those of you who have the program, even those of you who don't have the program and you're wondering, do I need to get this? That's the goal of these study sessions so that you can kind of see how to evaluate yourself. So we'll be doing page 13. And I actually took a great deal of notes while I was watching the video and also things that I wanted to add on to our slides for today. So Apgar score is what we're going to be going over. Let's get into it. First off, when you talk about the Apgar score, what population are we talking about? We are talking about our pediatric population. Specifically, the newborn, it is a systematic way to do a newborn assessment immediately after birth. Immediately after birth. Now, this again comes from the student workbook, V2 student workbook, page 13. The parameters that are done that you must memorize are going to be heart rate, respiratory effort, muscle tone, reflex, irritability, and color. Reflex, irritability, and color. Now, this is done when you have a 60-second interval. Like NCLEX may say 1 minute, or they may say 60 seconds. And then also at 5 minutes after birth. 5 minutes after birth. Okay. Now, what I want you to understand is that the reason why we love the Apgar score in general is because this is an assessment that can be done. And hello, everyone who's passing the NCLEX. I see the comments. Please also let me know what nation you're from, where you're representing, because we do like to go back and we do like to look at our audience on Mondays and Wednesdays. So who's showing up? Who is showing up on Wednesdays? Who's showing up on Wednesdays? All right. So, the reason why Apgar score is something that has been adopted in every newborn nursery is because it can be done without what? Without interfering with the care of the newborn. Meaning that these things that you're assessing, these things that you're evaluating, you are able to do without taking up too much time. This is a quick, systematic assessment that can be done. Okay, so it's done at 1 and 5 minutes, and it limits. One thing about the Apgar score is that it is limited to just the present condition of the newborn. So we are not doing the Apgar score. Understand this, we're not doing the Apgar score for long-term predictions, if that makes sense. We're not doing the Apgar score to teach on the future of the child or educate the parents about the future of the child. This is a very important point, because if we don't have that understanding, then we don't understand the reason why this has to be done so frequently. Okay, 1 in 5 minutes. Doctors may order a nurse to do an Apgar 4 times. They may say, do one at 1 minute, do one at 5 minutes, do one at 15 minutes, and then do one at 20 minutes. So this is just an understanding of when and how the Apgar scoring is used. Okay. So nursing considerations. What are we thinking about as we are doing the Apgar score? What are we thinking about? We are wanting to make sure that as we are trying to do this Apgar score, we make sure that that newborn is thoroughly dry. Okay, because if these things are not done, these nursing considerations, then the Apgar score can be skewed. So the baby has to be thoroughly dry. We want to make sure that the airway is patent. We want to make sure that the baby is warm. That's also very important as we are doing our initial assessment. The Apgar is a complement to an initial assessment. It is not considered a full assessment of the baby. And remember, the parameters for the Apgar is that it is done at 1 minute or 60 seconds, and then it is also done at 5 minutes after the baby is in the extrauterine environment. When we talk about the categories, before we go into scoring and numbers, I do just want to go over a quick review of normals and abnormals. Some of us have been out of school for some time, and we are warming and reintroducing ourselves back to this information. I want to encourage somebody who has been out of school for a long time. Maybe you failed NCLEX some years ago, and you're just getting back to the place where you're starting. What you will be surprised is that this information never really leaves you. And once you get exposed to it again, you will realize, oh, this is my thing. I really do like learning about this information, right? And so it comes back to you easier than you think. It really does. So I would just say, just be prepared to just get your feet wet and stay in this environment where you have and on the same path as you. Everybody in here is essentially trying to do the same thing as you. They're trying to make sure that they are prepared for the NCLEX. So stay here, stay here, because this is going to be a very important part of your journey. So we're talking about the skin color, normal skin color. What you're going to notice is that a baby struggling with cyanosis, really before the first breath, can be normal, right? So when a baby comes out, it can absolutely have some blueness to it. And so that is one of the reasons why that's one of the reasons why there is a push for delayed cord clamping after birth, because that is going to allow the baby to have more iron carrying capacity with their red blood cells. That is going to help increase their volume in terms of their body fluid volume, which will help them maintain a good color, maintain oxygenation. So most babies, when they come out, you will see that they have some acrocyanosis going on. And so that's why we are doing the Apgar score 1 minute after that birthing process. So cyanotic before the first breath is normal, but then pink after that first breath is what we are going to expect. Now, if a baby is pale, all right, if there is some cyanotic activity or acrocyanotic activity after the first breath, we may consider that to be abnormal. There was something else I had wrote, and I know I have mentioned it about color. There it is. Okay, so color. NCLEX may say cyanotic, which we know cyanotic is what color. But what other colors might the NCLEX say that the baby is that is still just as bad as cyanotic? What other colors would we expect to find here? So NCLEX, right. NCLEX may also say that the baby is pale, and just write it down because I wrote these into the box here, that the baby is pale, gray, the baby could be gray, and also blue, right? And this is the trunk of the baby. If the trunk of the baby is gray, that is a bad sign. And so we would be giving our baby actually a 0 if we are going to see that. But I don't want to get into the numbers just yet. So cyanotic, acrocyanotic, even after the first breath, abnormal. If the baby is pale, gray, or blue, then that is also abnormal. The normal heartbeat, normal is more than 100. We're talking about the pulse rate now of that infant. Normal is 100 beats per minute upon auscultation. This can be anywhere from 100 to 140. We're going to be happy with this. Abnormal would be below 100 beats per minute. Certainly, if the heartbeat was below 60, below 50, we're going to be very concerned. The grimace indicates a facial evaluation. And so normally, like this baby here, if you have a response of, if your baby is, if they're crying, if that forehead is wrinkled, if they have a movement of their mouth, if they're squinting their eyes, this is a good indication that the baby has some irritability, their reflexes are strong. We love to see this. Now, abnormal would be if there is no change or maybe no response or a slight grimace. Assessing muscle tone. So our baby's muscle tone is looking for active movement. Now, this baby right here looks like there's really not a lot of movement going on because they are sleeping. However, if the baby was awake and we saw that the legs weren't moving or if the legs were limp, we would know that this is an abnormal assessment. So what we're going to look for, spontaneous muscle movement. If the baby is well flexed, and if there is strong resistance to pulling out those extremities straight way, like this baby's extremities are pretty straight. Typically, babies like to be scrunched in. Let me see. It's kind of like how I like how this baby is. It's like tight, well flexed. This is the baby flexing on you. Does not want to be. I know I have some more of the pictures. Let me see. That baby looks like it's not well flexed in the same way. Oh man. So this baby right here, this baby is tight. They are flexed. So that's what we want to see here. Abnormal would be inactivity or floppy, limp extremities. The respiratory rate, this is going to be very important because we are looking for a baby to have regular, rapid respirations after that first cry. First cry is very important to get the stimulation going. So we would love for the baby to continue to have those strong breathing patterns, equal chest movement. Abnormal is going to be irregular respirations and or if the baby is having difficulty breathing. So here are the overall characteristics as well as the number category that you have to have memorized. So there are 5 categories to the system. Every child can get anywhere from a 0 to a 2. And so you have to know whether this score is a 0, a 1, or a 2. It's not so bad. It's not so bad for you to memorize, actually. This is a very subjective chart. What else did I want to say about this? Okay, so let's go over this together in terms of this entire chart. So it's called the Apgar score, and you can remember the characteristics by the word Apgar. Okay, so if you know Apgar, you can know these characteristics. The A is going to stand for the appearance of the baby, the skin color. So a baby that is totally blue, they are cyanotic, would get a 0, because 0 is the worst. It means you don't have it typically. So if you don't have any color, if you don't have pink color, then you get a 0 for blue. You would get a 1 if the extremities are blue extremities, but the trunk is pink. So this part of the baby is pink, but the arms and the legs are blue. That baby gets a 1. A baby would get a 2 if the trunk and the extremities are a normal pink color. Pulse rate. If the pulse is absent, then the baby gets a 0. If the heart rate that you are given is less than 100, then you get a 1. If it is 100 or more, 100 to 140, you're going to get a 2. Now, sometimes students are confused because NCLEX will say the baby's heart rate is 100. And so students are like, I don't know, is that a 1? Is that a 2? Is that a 1? Is that a 2? If NCLEX says the baby's heart rate is 100, what are we going to give them? We're going to give them a 2, a 2, a 2, a 2. Grimace, if the baby has nothing, if they are flat affect, there is no facial movement. If they are silent, then we would give them a 0. If the baby has some whimpering or slight grimace, is what I say in the V2, then you give a 1. And if your baby is crying, also at this, if the baby is sneezing, if the baby is coughing, then give that baby a 2, a 2, a 2, a 2. Your activity, remember we're looking for Apgar, so APGAR. A stands for activity, so the muscle tone, remember, we want the babies to be really tight, well flexed. So if the baby is limp, totally limp, that baby gets a 0. If there is some flexion, moderate flexion, maybe the arms are flexed, but the legs are limp, that baby gets a 1. And then if the baby is well flexed, then that baby gets a 2. Okay. All right, there we go. All right, and then respirations, 0. If the baby is a 0, right, no respirations, then they're going to get a 0. Irregular breathing gets a 1, and then regular breathing, the baby is going to get a 2. Baby's going to get a 2 here. So our interpretation is that really anything from 7 to 10, this infant is in a great condition. We would love for babies to get a 10. But if they get anywhere from a 7 to a 10, they're in great condition. The 4 to 6, you would have to do some monitoring. This baby might need some resuscitation depending on the category. And then 0 to 3, this baby is in severe distress, probably going to need some heavy interventions, probably some CPR, some chest compressions, as well as mechanical ventilation, or at least manual ventilation. But the overall goal is that even if our baby gets a 10, we will still continue to what? We will still continue to monitor this baby because situations can change. And Apgar is just telling us about how our baby is doing right now. There are some causes for the Apgar score to be lower than normal. And you guys are doing so well knowing this information. You have obviously been exposed to it in nursing school. You love it. You've remembered it, and you have taken time to master it and even showing up for class now. I'm going to challenge you with the NCLEX question cell. You know, that's what I like to do, making sure you know this content. So the causes of low Apgar score are going to be a preterm birth, a neurologic impairment, if there's any blockage of airways for any reason, pulmonary disorders that our babies might have, or congenital heart defects or congenital heart diseases. And I wanted to definitely talk about this because in the newborn review, there is a page called Infant Heart Defects. And so there are infant heart defects that you want to make sure that you know. I would say out of all of the ones that I discuss up here, tetralogy of Fallot, this one right here, is the most important one. So if you're in the free trial of the V2, you can actually watch that video. If you're in the free trial of the V2, all of my maternity videos are part of the free trial. So check it out. Go to remarnurse.com, sign up for that free trial. You don't have to pay anything. You don't have to put in a credit card. It's literally just your email address, your first name, I think, last name, and email address to take the trial of it. And so knowing the infant heart defects are going to make you feel more comfortable when it comes to your maternity overview. Okay, so your nursing priority here, if the baby has any form of apnea, because if thinking about the category of respirations, what would you give a baby, a 1, a 2, or a 0? 0, 1, or 2, if it's documented that the baby has apnea. What is apnea? Is apnea a 0, a 1, or a 2? Say the baby has, make sure, let me see. Say the baby has a normal color trunk, but the extremities are blue, but they have apnea. What would we rate the respirations in that situation? Right? Exactly. So we're going to say if apnea is present, that is a 0, because that means that there is no breathing. That means that there's nothing happening. So that's going to be very important. Also, like I said, a heart rate less than 60 indicates that something is very, very wrong with the baby. If it is less than 100, then we know we're not going to be able to give the highest points of 2, but the baby will be getting a 1, right? Other things that are danger signs in newborns: labored breathing, persistent cyanosis, and irregular heartbeat. Persistent cyanosis, labored breathing, and irregular breathing may require you to adjust the baby. Because one of the reasons the Apgar was developed is because when infants used to show these signs, oh my goodness, you guys are not going to believe this. Maybe you will, maybe you won't. But before the Apgar score came into place, if a baby came out and that baby had acrocyanosis, the arms and legs were blue, the doctors would look at that newborn, because they knew very little about the population, and they would what? They would say, this baby is blue. Let's just put it to the side. It's not a healthy baby. It's probably not going to make it. So they would literally like stop care. And nobody thought to think, hey, what if we just gave this baby a little oxygen? Or what if we just manually stimulated this baby, right? None of those things were done. So many babies died, even though they were born full term, because there was a lack of understanding of the neonatal supportive measures. So now what do we do? Yes, what are we going to be doing for that baby? We are going to be repositioning that baby to make sure that the airway is patent and the head is in the correct place. We're going to be suctioning the baby, because maybe they just need to get some gunk out and we just need to support them there. We're going to make sure that infant is warm, because that always helps too. And we're going to open the mouth and do the 10, the head and jaw forward, right? Chin lift, jaw forward. And then we are going to be administering oxygen. And so these little small things make such a huge difference in improving the infant mortality rate. And so I'm so happy that we have people like Virginia Apgar and other pediatricians that really took the time to improve the mortality rates for our little patients. And many of you who will be working in mother baby and in the newborn nursery and in the newborn NICU, God bless you. You are so needed in the field of nursing. Do I have a lot of L&D nurses here, or mother baby nurses? Y'all are the best. NCLEX questions coming at you. I am looking for you to get, I've been doing 5 out of 5. The Monday motivation, I asked for 5 out of 5. Some people got it, actually. Some people did get it. I think you can do it with this. I think you can do it with this subject. So let's start with the first question. Here it is. The first question is this. I'm gonna make it really big. Hold on. A newborn infant 1 minute after birth has a vigorous cry, appears pink with a heart rate of 128 beats per minute, and presents flexion of extremities and has active movements. What is the appropriate intervention at this time? Okay. So you see the characteristics there. This is what I mean by having to have this memorized. If a baby has vigorous cry, appears pink with a heart rate of 128, and flexion of extremities and has active movements, what is the appropriate intervention at this time? Number 1, monitor closely for signs of distress. 2, start IV line in preparation for IV therapy. 3, administer 2 liters of oxygen via nasal cannula. Or 4, suction the nose and mouth. What are we going to do based on this presentation of the newborn? At 1 minute, what are we going to do? Correct answer, I see it on the screen. Not bad at all, actually. Correct answer is number 1, monitor closely for signs of distress. If you add up all the characteristics, this is a pretty great looking baby. The Apgar score is 10. The appearance is pink, so that is going to be 2. The baby has a heartbeat of more than 128 beats per minute. There was a vigorous cry as well. That's also a 2. The flexed extremities and the active movement. So all we can do is monitor closely for signs of distress. All of the other All of the other indications here, it doesn't seem like we need to do suctioning the nose and mouth, administering 2 liters of oxygen, or starting an IV line. We don't seem like we have to do that for this baby. It's doing pretty well. Okay, let's do question number 2. Here we go. This is a numbers, adding it up. What is the Apgar score for a newborn delivered 5 minutes after birth with the following assessment? Okay. Bluish lower extremities, heart rate of 92, responses after rubbing, some flexion in the extremities, and has slow, irregular breathing. Is it 3? Is it 5? Is it 6? Or is it 7? So if you get this question on NCLEX and you're sitting there, you're like, okay, in my mind, what does the chart say? You guess what? That's what you got to have this memorized. Okay. This chart here that you're going to do, this one right here, make flashcards, do what you have to do, write it over and over and over and over again. Whatever you got to do. But this is a part of the book you have to have memorized. All right. So this copy also, really quickly, this is the physical copy somebody asked, but the downloadable one that you get with V2 is similar to this. All right, this is the add-on. So if you want me to print it out for you and it look like this, you do have to add this on as an additional expense. But everybody gets the printed workbook. I don't have my printed workbook, but it's pages that you print out in the file vault. So you can find it in the file vault. You just have to print out all the pages and you can put it in a binder or whatever, however you want to keep it. So anyways, let's go back to it. Okay, I'm going back to it. So what do we have here? Bluish lower extremities. What is that? A heart rate of 92. Okay, you guys have it. Let me just show you the answer. So the answer is 5. So a breakdown of it, the extremities that are cyanotic makes it a 1. The pulse rate under 100 makes it a 1 as well. The facial grimace, what do we say? Response after skin rubbing. So that's moderate stimulation. That's a 1. Some flexion in the extremities, that is another 1. And then irregular breathing, shallow breathing, irregular breathing, that makes it another 1. So that's 5 ones is 5. Did you get that one? Yep. Question number 3 says a newborn with an Apgar score of 0 and 5 is going to be roomed in the nursery. The nurse anticipates that the priority intervention would be, number 1, prepare the newborn warmer to 97.6 degrees Fahrenheit. 2, set up for IV insertion. 3, turn on the apnea and cardiorespiratory monitor. Or 4, prepare the resuscitation bag with oxygen. What are we going to do? What are we going to do? What are we going to do here? The correct answer. What should we do for this baby? I think it's pretty apparent, but let's go over it. It is number 4, prepare the resuscitation bag with oxygen. This baby is not doing well. All right. 0 and 5 are the scores. So the nurse should prioritize maintaining the patent airway and preparing the resuscitation bag with oxygen. And that is better. Maybe some people turn on the apnea and cardiorespiratory monitor. That is great. But what we want to see is the step towards maintaining a patent airway. And so the manual resuscitation bag with oxygen will deliver that patent airway. That's going to be the priority. Okay. Are we good? Are we still doing good? Are we about to be on our 4 out of 4 streak? And this is what I love about Wednesdays. It's just a quick check-in. It's just a quick, hey, this is still important to me. Hey, I still want to listen to this. I've made time for this. And if you're like me, this part of your week, I replay my videos. I'm the type of person that even if I'm here on live, I still will replay the videos and read the comments to help me to remember for the next time. Okay. So I get it. I'm really here with you all doing this work. Question 4 says this: the most recent Apgar score of a newborn is 6. The newborn is cyanotic with shallow respirations. heart rate 110, which of the following supportive interventions should the nurse include at this time? Okay, so we're not given everything. Look at what we're given. What is the following supportive measures, supportive interventions that the nurse should include at this time? There's only one answer to this right here. Number one, chest compressions. 2, transfer to a cooler environment. 3, rub the newborn's back. Or 4, delay cord clamping. This is good. Most recent Apgar score of the newborn is 6. You have shallow respirations, heart rate of 110. That's it. That's all you know. Which of the following interventions should the nurse include at this time? Number 1, chest compressions. 2, transfer to a cooler environment. 3, rub the newborn's back. 4, delay cord clamping. So good. Correct answer is, I see you. It is number 3, rub this newborn's back. We want to stimulate this baby. Stimulation does wonders. The nurse should continue to stimulate the newborn to monitor the response to stimuli at this time. Along with that, the patient should be put on oxygen therapy, probably at specific intervals. Chest compression is needed for heart rates that are below 60. Delayed cord clamping, the supportive goal is to improve iron stores and blood volume improvement. And newborns still need to be in a warm temperature. So those things, again, with NCLEX, you can have some other answers that are correct, and you probably can rationalize them to yourself why they make sense. But at the end of the day, you have to be able to prioritize those interventions. You have to be able to prioritize those interventions. So that's what we work on doing. Question number 5. The nurse notices persistent cyanosis in a newborn. However, the heart rate is 130 beats per minute. Respirations are 36 breaths per minute. Reflexes are normal and extremities well flexed. What should the nurse do at this time? Number 1, connect to a cardiac monitor. 2, conduct a thorough neurologic assessment. 3, provide a warmer environment. 4, begin feeding with formula or breast milk for the infant. Look at all these little details. The answer is in the details here. What should the nurse do? We have number 1, connect a cardiac monitor. 2, conduct thorough neurologic assessment. 3, provide a warmer environment. 4, begin feeding with formula or breast milk, okay, for the infant. What are you going to do? The last one, I think, is the trickiest of them all. But the idea is for you to just critically think just a little bit. Nurses Week is next week. We're going to do the critical thinking workshop. But for today, what do you have? Correct answer is going to be 3, provide a warmer environment, because the problem is stated in the first sentence. Everything after that is really, it's just really extra stuff to know, but they give you the problem in the very first sentence, which is the nurse notices persistent cyanosis in a newborn. Okay. So that's the abnormal assessment here. Why is the baby continuing to be blue if everything else is good? And then what should the nurse do about it? Are you going to put the baby on a cardiac monitor? Are you going to conduct a thorough assessment for the cyanosis? Are you going to provide a warmer environment or begin formula feeding? So correct answer is going to be warming that baby up, because if a baby is cold, that can absolutely contribute to the cyanosis. Babies have a very hard time keeping themselves warm. And so we want to make sure that we are providing a warmer. We always put the baby in a warmer, put them in a blanket, put a hat on their head, to make sure that they stay warm, get their pink color. Oh my goodness, we have the most help in our books. Our books are going to really help us to be able to read this information, take notes, and also be able to retain it, because it's not just about hearing it one time, it's allowing it to stay in your mind. So we're studying from Quick Facts for NCLEX. If you're not ready to take NCLEX and you're just watching me, maybe you're just starting nursing school, go ahead and get Quick Facts for nursing school for you. But the rest of us, we either have Quick Facts for NCLEX or we have Quick Facts for NCLEX, and you have my full program, which includes the downloadable V2 workbook. But I will print this out for you if you put it in your cart. If you put this book in your cart, then this book can be printed out for you, okay? So these are the things that we are working on, that we are grinding. Remember our nurse, wasn't it CB? She said she had to grind the books. And so grinding the books is just like what I did today. You watch that lecture, you get out your workbook, and you are taking notes. You're grinding the books and you're filling it out. And so I am going to continue to do the rest of the lectures as I'm studying with you. It's graduation season, it's NCLEX season. And so one of the things that we will be doing very excitingly is Nurses Week, which is coming up next week. I will be saying it over and over again. Nurses Week is happening. It's happening. So you don't want to miss it. It starts on Monday. So we will be going over questions, actually, and you'll see them in your work. I'll email you this. When you sign up for Nurses Week, if you go to remarnurse.com/Nurses Week, you will get this workbook. I'm just going to email it to you. Just make sure you print it out. Monday Motivation actually has a lot of questions on it, actually. So these are the questions that we'll be going over, and you can feel free to go over them if you want to earlier, but the answers are not in here. We'll do the answers together. So Monday has 12 questions. You know, usually I only do 5. So I'm going to do 12 questions. I don't know how long it's going to take me. And then the anxiety workshop. So print this out over the weekend. If you have a printer at home, you can print it in black and white. You know, I have to be a little fancy, so I print it in color for you guys. But it's going to be a great week. Lots to discuss, lots to share. And especially if you have been taking time doing other things, you put NCLEX on the back burner, it hasn't been a priority for you, this is an amazing opportunity for you to kickstart the formal process of preparing for the NCLEX exam. So this will kickstart your training all next week. You know you can be with me. And then, of course, the goal is that when this is all over, you take advantage of taking my full course, getting into the V2 program, to make sure that you are learning this information the best way. You got to have a plan. So the V2 comes with that daily study calendar, the quizzes that you need to help you stay accountable, and me. I teach all of the lectures, and I'm here doing all of the study sessions. So you never have to pick and choose, you know, what teacher you're going to study with, because it's always going to be your girl here. So it's a great opportunity for you to get prepared for NCLEX. Again, the pleasure for Winning Wednesday is always mine. It always is mine. I'm excited about Nurses Week. You have the weekend now to rest and recuperate. And on Monday, we hit the books hard. Thank you so much for watching, guys. I love you. Have a great week. Bye-bye.